reason I wanted to have this done today is I want to advocate for the endoscopy nurses who don't get the opportunity to have their allocated time for training, ongoing development, just to make sure that we're not left out, to make sure that we also get the opportunity to learn new things, new advancements, new technologies regarding endoscopy.
Trainings like this are really rare, and it's good that it fell on a weekend where we don't work as a department, so I was able to pull as much of our team as possible. As far as this day has been, we've been getting a lot of good feedbacks from the rest of the team.
So I chose to attend today because it's one of the very first conferences tailored towards nursing and endoscopy. And as someone who is not new, but there's things I'm not really aware of in endoscopy, I thought this was crucial for me to attend, and I'm glad I did because I've learned so much of the background of why I do some of the things that I do, and it was great to network with other like-minded nurses from across the country, and particularly in Wales.
We were just talking about that we can't believe that there are some practices that we thought was okay and acceptable, but now we're thinking twice about our practice, and I think we're picking up best practice from this course.
I'm nearly new to endoscopy. It's my first job as a nurse. So as a newbie, I found it really helpful, especially today morning class. Senti, she has introduced and talk about the basics of endoscopy, tools and how to use it and the proper way of using the tools and the systematic approaches. It's really, as a newbie, it's really helpful.
The most encouraging benefit is to meet the nurses who look after and care for our patients every day on daily basis, and to understand their practice, and also to see their interest in knowing all the little details of the endoscopy.
The networking is really helpful because now we are just liaising with the other trusts, how they're doing their practices.
I think it was really great to see that the endoscopy nurses get to play with the accessories, have that feel, improve their dexterity, just to have that time to play with the accessories, especially doing it in a simulated environment where it allows room for mistake without compromising patient safety. So having these opportunities to do it, they get to learn from these mistakes, and hopefully once they're in an actual procedure, they learn from it and they know how to do it properly and to make sure they get to do the procedures safely.
It was empowering to see that a nurse organise this today, for other nurses, and recognise the need for such a tailored approach to making sure that nurses are competent and aware of all the new accessories and equipment in endoscopy.
So having the dedicated day, just focusing on, training and development, it gives them that empowerment and motivation that they are an integral part of the endoscopy team.